Welcome to Vet NeuroJar, the podcast dedicated to exploring the intricate world of veterinary neurology. Today we're diving deep into a fascinating and relatively undocumented condition, Holocord Syringomyelia, or HSM, in dogs. Syringomyelia, in general, is a term that might be familiar to many of you. It describes a fluid-filled cavity within the spinal cord. It's something we commonly see in certain small breed dogs. But Holocord Syringomyelia? That's a different beast altogether. It's characterized by a continuous spinal cord cavitation that extends along the entire length of the spinal cord. Now, while Syringomyelia has been extensively studied, particularly in breeds like the Cavalier King Charles Spaniel, HSM has remained largely in the shadows. A recent study has brought this condition into sharper focus, and we're going to unpack its key findings today. This research, a retrospective multi-center case series, delved into the clinical and magnetic resonance imaging, or MRI, findings of 18 dogs diagnosed with HSM. The study was conducted across 3 referral hospitals in the United Kingdom, ensuring a diverse pool of cases. The aim was to describe the clinical signs, MRI characteristics, and outcomes associated with HSM, ultimately improving our understanding of this severe form of Syringomyelia. Let's start by painting a picture of the dogs affected by HSM in this study. The median age at presentation was 82 months, with a range from as young as 9 months to as old as 108 months. Body weights varied, but the median was around 10 kilograms. Interestingly, French Bulldogs were significantly overrepresented in the study, accounting for 50% of the cases. This is a crucial point, as it suggests a potential breed predisposition for HSM. Other breeds included Chihuahuas, Boston Terriers, and Cavalier King Charles Spaniels. Now, what were these dogs experiencing? What brought them to the veterinary neurologists in the first place?
Well, the clinical signs varied. Some dogs exhibited signs of myelopathy, which includes general proprioceptive ataxia and motor impairment. Think of incoordination, weakness, and difficulty walking. Others showed signs of spinal pain, paresthesia, and allodynia. These are indicators of nerve pain, abnormal sensations, and pain responses to non-painful stimuli. Some of the behaviors include vocalization when scratching the cervical region or moving the head, an abnormal head or neck posture, licking a distal limb, aversion to touch, or phantom scratching. What was truly striking was that 22% of the dogs had no apparent signs directly related to HSM. In those cases, HSM was found during diagnostic imaging for another issue. To further categorize the severity of the signs, the neurologists used a grading system adapted from established scales for spinal cord injuries. This allowed them to objectively assess the degree of neurological impairment, ranging from spinal pain alone to tetraplegia, which is paralysis of all 4 limbs with ventilatory compromise. MRI played a crucial role in diagnosing and characterizing HSM in these dogs. The scans revealed that the cranial extent of the syrinx, or fluid-filled cavity, was most commonly at the C1 or C2 vertebra. The caudal limit varied, reaching as far as the L3 vertebra in some dogs and the L6 in others. The study also looked at the conus medullaris, the terminal end of the spinal cord. They found that it most frequently ended at the L6 vertebra. Another interesting observation was whether the HSM appeared uniform or non-uniform. In some dogs, the syrinx height remained relatively consistent along the spinal cord, while in others, it changed noticeably in different regions. Perhaps unsurprisingly, a significant majority of the dogs, 94%, also exhibited MRI features of Chiari-like malformation and other intracranial or craniocervical junction malformations. This is a complex area, but it essentially means that many of these dogs had abnormalities in the shape and structure of their skull and the junction between their skull and spine. The severity of Chiari-like malformation was graded based on the cerebellum morphology. So what about treatment? How are these dogs managed?
The approach varied depending on the individual case. Some dogs received medical therapy, others underwent surgery, and some received no treatment directly targeting the HSM. Medical management typically involved medications like gabapentin, prednisolone, and nonsteroidal anti-inflammatory drugs, or NSAIDs. These medications aim to address pain, inflammation, and nerve dysfunction. In one case, a dog underwent surgical decompression of the caudal cranial fossa, along with other procedures. The goal is to alleviate pressure on the brain and spinal cord, hopefully improving cerebrospinal fluid flow. Now, for the big question, what were the outcomes for these dogs with HSM?
Follow-up information was available for 16 of the 18 dogs, with a median follow-up time of 12 months. Sadly, 2 dogs had passed away during the study. Of the remaining dogs, only 1 showed improvement, while a significant proportion, 56%, deteriorated. Around 25% remained static, and a small number remained free of HSM-associated signs. It is worth noting that the quality of life, as subjectively reported by the owners, was generally positive. This study, while providing valuable insights, also had its limitations. The retrospective design, small sample size, and variability in MRI protocols all need to be considered when interpreting the results. The follow-up period was also relatively short, making it difficult to draw conclusions about the long-term prognosis. Despite these limitations, this research represents a crucial first step in understanding Holocord Syringomyelia in dogs. It highlights the importance of considering HSM, particularly in French bulldogs presenting with neurological signs. The study also underscores the need for further research into the underlying causes, natural progression, and optimal treatment strategies for this challenging condition. So, what are the key takeaways from this exploration of Holocord Syringomyelia?
First, HSM is a rare but severe form of syringomyelia characterized by a continuous fluid-filled cavity along the entire spinal cord. Second, French bulldogs may be predisposed to HSM. Third, clinical signs can vary, but myelopathy is common. Fourth, MRI is essential for diagnosis and characterization. Fifth, treatment options are limited, and the long-term prognosis can be guarded. This study opens doors for further investigation. Future research should focus on identifying genetic and developmental factors that contribute to HSM, refining diagnostic and screening criteria, evaluating the effectiveness of different therapeutic interventions, comparing HSM with Chiari-like malformation-related syringomyelia, performing more objective morphometric analyses. That's all for today's episode of Vet NeuroJar. I hope this discussion of Holocord Syringomyelia has been both informative and thought-provoking. It's a reminder that even in well-studied areas of veterinary medicine, there are still uncharted territories waiting to be explored. We keep those minds inspired, hearts light, and tails wagging.